Welcome back to Foundation Physical Therapy's YouTube channel. This is just a short video for advice for patients that may be recovering from some sort of knee surgery, from some sort of any kind of knee injury where you need to start working on your range of motion, how to safely use a bike without harming your knee or causing a lot of pain. So, quick thing that you want to do is I prefer a sit-up bike or a traditional stationary bike instead of a recumbent bike. Recumbent is where you're sitting more in a chair. Those require more knee flexion than this will to start with. So when you can get a hold of a stationary bike and you're working on range of motion, you want to start with the seat roughly at about hip level, or if you drop your arm, the wrist should end up at about the height of the chair, and that should normalize it. Now every bike is a little bit different, so you want to try it out. Then once you're on and you're in the stirrups, when you come up, this knee is obviously going to bend here. At the bottom, you want to have a tiny bit of bend in the knee. You don't want to have a hyperextended. You can't really see it with my pants. You don't want to have a hyperextended knee because that can be painful too. Now, this may be a little too challenging to begin with, so it's okay to bring the seat up. By that same rationale, you can start to slowly drop the seat down. But one thing you want to avoid is having a very, very low seat and pedaling for a prolonged period of time down here, right? Because what that does is when I get a very close angle here in my knee, it can be okay to do for maybe a couple minutes just to work on the range of motion. But if I pedal here for a prolonged period of time for exercise, then I'm going to really load that anterior compartment of the knee. The front of the knee, the kneecap is going to be painful and sore. So you want to start high. It's okay to start too high rather than too low, and then progressively work yourself lower and lower, and down on the height of the seat.